We're still waiting on a confirmation. So it seemed like we're having some technical issue with the internet. Just waiting for confirmation here. This is Dr. Ferris or Basic. I'm coming to live event. Just ask your dentist. Uh, we It's been hosted by Icon Dental Implants, Sedation, and Family Centers. Okay, we're still waiting on a confirmation. This event, I'm gonna try to have this event on a weekly basis. So please join us. It's a representation of um, actual questions that's been asked to me, been emailed or been posted on my page about what we do and how we can improve your smile, your well-being, and your dental health. So again, this is Dr. Ferris Razik, and this is live event. Just ask your dentist, and I'm waiting for confirmation of voice quality and pitch quality before we get started. Um, I didn't um, I didn't posted this event earlier. This is going to be a test coming back again for the same event that we had it last year, where we can answer your question, your concern. Feel free to join us live uh, and check with us, ask a question. There is no wrong question to ask. There's always more information that we can interact with you and answer a question and give more information and not to educate, but also to learn about you and your situation and how we can help. Um, so you're welcome to join us. If you actual patient of us, you're welcome to join, of course. And even if you're not actual patient of us, we'd love to have you as a patient. Please join us to this event. And so it seems like the frame is a little bit rate is slow. Okay. Um, we having some difficulty of the internet connectivity because the weathers we've been promised by AT&T that this is will be fixed, but we have to be patient. I know there's a lot of flooding, a lot of storm affecting us in California here. And if you join us from other states, you're welcome as well. Okay. So it's been 8 minutes. I'm sorry for the wait. I'm just still waiting for confirmation. I haven't invited anybody yet to this event, so I'm waiting for actual confirmation. So can you hear me? Good evening. Coming to you again from Icon Dental Implant and Sedation Center. If you've been watching this for a while, I apologize for the delay. Coming to you live from Icon Dental Implant and Sedation Center. This is your host, Dr. Ferris Razik. This event is Just Ask Your Dentist. So if you have any questions, please feel free to post your questions. And I think we waited enough. If you're not watching us live now, you can watch this recording. Promise gonna post it so you can hopefully benefit from a sincere conversation about real questions and answers that my patient asked me in a clinical setting upon the examination when we do comprehensive exam, and even questions that's been asked to me by friends and family. If I met with you on a outside the dental practice, I get these questions as well before actually um, a person in need of dental health, in need of dental rehabilitation, um, want to take this first steps in getting the courage to make it to the dental office. And believe it or not, so it takes a lot of courage from you to make that decision, and for a lot of patients. So if you are about to take this decision, it's I want to tap on your shoulder and encourage you that this is a good step for you, and it should be on a no commitment basis. It should be meet and agreed um, question in examinations, or even a simple consultation with your dentist. Hello again, and I see more people start watching us now. Hello, this is your host, Dr. Faris Arazik, uh, from Icon Dental Implant Institution in Family Centers. So this presentation about a real question, and hopefully you get a benefit from answer. These questions maybe you ask your dentist before, or you want to ask your dentist, or even you should ask your question if you haven't asked it before. Okay, so the first question from today, is I've been having this wonderful conversation with a patient upon examinations, and the question was, Dr. Ferris, I know that I need a lot of treatment and I need a lot of filling, but I cannot afford getting all this treatment done. So where should I start? And there was some good follow-up question from my patient Larry, um, about should I make the treatment? Should I start with the front teeth? Should I start with the back teeth? And how? What do you think the optimal approach for my treatment planning? And basically, this questions the answer for this question should come from the interaction between the dentist and the patients, and based on the severity of the condition, also based on the need of the patients, in the priority of the patients. So many times the priority of the biology different from the psychological need of our patients. So, for example, to answer where to start, should we start with the front teeth or should we start with the back teeth? And the answer for these questions um, is, do we have important need for the smiles? If there is an important event in our life that we need the smile now, that we can jeopardize the function for a small period, I would say I will take that risk and work on the anteriors in the smile first. In ideal situation, we have to have a protective bite or protective occlusion, which is mean that we have to have a stability in the bite, so the posterior teeth can protect the front teeth and be guided by the front teeth. At the same time, the contact of the front teeth will protect the posterior teeth. So this is what we call a mutually protective occlusion or a mutually protective bite. So for my male patient, which is function come as a priority and chewing come priority above aesthetic. So many times we start with the posterior teeth. I want to tell you that this is not right or wrong approach. There's no right and wrong approach. Ideally, we have to have both. In aesthetic and function, anterior teeth and posterior teeth working hand in hand. So the conversation took us to the next question. Hi, Georgina. Georgina joined us from Australia. Greeting to Georgina. So, coming back to the question of, well, I have two filling, and I can start with this one or this one. If there is any difference, where to start? And I would say, when we compare a filling need, when we have a cavities, it's not all cavity are created equal. So we have to start based on the severity. So the prognosis of tooth filling might not be the same. The longevity of those two different teeth with the two different type of cavities, okay, might also differ. The depth of the cavity also might be different. The amount of surfaces that involve in the cavities also might differ. So please check with your dentist, just like what we do in here. Ask your dentist which cavities we should start first. So if we have two cavities, even though ideally we should have both of them done, but if I have to choose one, I would choose the one that's in a location very important for the patient, and also for a tooth that will last us longer, and also based on the severity, the depth, and the need for the patient. So all these questions and all these factors are important when we make that decision. So a lot of decision making when we do even choose between two filling or two cavities. So that was the question from Larry today. Um, and I hope that you enjoyed this uh, question answer conversation. Again, this is your host, Dr. Faris Arazik, from Icon Dental Implant Installation Centers. I know I'm having a lot of questions coming regarding dental implant that I promise we're gonna also answers in a future episode of Just Ask Your Dentist. Hope you have a great evening, and thank you for watching this video. Please post a comment how we can improve this event. We want it to be beneficial to you and to the community. And if you're looking for a dentist, give us a call, 559 733 CARE 2273. 559 733 2273. Until the next episode of Just Ask Your Dentist, I'm looking forward to see you again. Ciao. Good night.